It varies from patient to patient, but in the most severely affected cases, and I've seen an awful lot of these, patients lie in a darkened room because they can't tolerate light or noise. They're in chronic pain. Most of them are unable to move and unable to speak. And at the moment, there is literally nothing that can be done to help those that are really severely affected.
It's still not taught as an undergraduate subject. It's not taught properly as a postgraduate subject. I just saw a poll recently that people in general medicine, registrars training to be physicians, 80% believe it is a psychosomatic disease.
And even though we'd had that diagnosis, we felt that we weren't being believed anymore. I had a report back from somebody, a verbal report. It was something like, the trouble is, nobody thinks that she can be as ill as she is with just ME.
And she was moderately severe. But then she got more severe, and this is one of the risk factors. The severe case of ME is not tolerated by professionals. The paediatrician lost her nerve and referred her to psychiatry, who made the alternative diagnosis of a thing called the pervasive refusal syndrome. It wasn't a case of pervasive refusal syndrome. She was cooperating, she was just very ill. And by the time I was called in to intervene, I found her on a psychiatric ward, curled up in the fetal position, being tube fed, and very, very sensitive to light and sound. And every time the nurses closed the door, a shudder went through this girl's body. But the psychiatrist would not allow her to have ear protectors because that would increase her sense of withdrawal. And the psychiatrist insisted on talking to her in a loud voice, and thought this way they would cure her of her pervasive refusal syndrome.
And this is a worsening of illness under almost any type of stressor. Physical, cognitive, emotional stressors can all trigger relapse with this illness. The duration of the effect can be days, weeks, months, and sometimes forever. So sometimes people do not recover.
And the first law should be to do no harm, to not make the condition worse by allowing the patient or pressurizing the patient to do too much.
Her GP had worked in a hospice for 10 years looking after cancer patients and said that in that job she could not always take away pain, but she could manage it. In Merrin's case, the GP said that her pain was unmanageable. And although Merrin was on diamorphine and ketamine, she was still in pain. Any kind of stimulus, even just a nurse walking into the room, was an exertion to Merrin.
Once someone pulls the trigger to set child protection proceedings in motion, it is like an ocean liner, it is like a juggernaut. It is very difficult to reverse. You have a social worker who's trained in child protection. They're used to parents protesting their innocence. They have to overpower them, and they keep going. And the further the proceedings go, the more the professionals dig in and cannot afford to lose face or to admit that they are wrong.
Doctors decided she wasn't improving, so the decision was made to section her. She was sent to a hospital for the mentally ill, a decision her family believe cost her her life. They totally lost faith in the medical profession, Sophia's illness had been treated as a mental problem, a common misconception with ME, but her family knew it wasn't, and finally she was allowed home. But by this stage, she was gravely ill. Sophia's family believed she would be alive today if she'd received proper care. Now, the result of this inquest proved she was suffering from a chronic disease, because when they examined her spinal cord, it showed there was clear evidence of disease, proving this is not a mental illness.